Yeah, that's one way to lose your baby teeth. Put your kids in sports,
God.
and they'll be gone. Welcome in for another episode of Tired Parents Club. I am your host, Kevin Pinto. We have
And I'm Sierra Langford.
Perfect. This is a place we can share, laugh, vent, talk about the ups and downs of raising the littlest versions of ourselves. Today, what are we talking about, Sierra?
Well, it's springtime, and many parents are getting their children, whether you have elementary, middle school, high school, even college, they're getting them into spring sports.
Woo, sports.
Yes, and we're specifically talking about the dark side of sports.
Bum, bum, bum.
Injuries.
It's injuries. So we grew up playing sports. I grew up probably playing sports longer than you.
Yes.
What sports did you end up
Yes.
playing when you were growing up?
So growing up, I actually played softball. I did it in elementary school and I did it in middle school, and I kind of had to stop around 8th grade because the ball got too fast for me, Kevin.
And I think that happens to us eventually. I played baseball, right? So I was able to keep up until about college. I played like maybe a little bit of a year.
Okay, much farther than I got.
But it hits us eventually, I think, unless you're as dedicated as some of those other guys were. We probably weren't as dedicated. I think that's the
Mhm.
biggest problem.
No, I think there's like a wall, like especially I don't know. I feel like you either have it or you don't in baseball or softball, and I definitely got to a point where I'm like the ball just right by me, could barely see it. It was already in the catcher's mitt. I didn't even realize it was passing me. I was like, it's time for me to step away.
That's it. Yeah, no, I mean, I followed it pretty well. Yeah, it definitely just slowed down. And it's time to retire.
Mhm.
And mine was college.
What kind of injuries did you see?
The injuries
When
that
you
I see,
played?
man. So
Yeah.
mine were usually ankles. We had ankles getting twisted up or whatever, and then I played basketball a lot too.
Oh,
Terrible
okay.
basketball
Basketball.
player. Obviously, I was center. Now I'm 5'8", guys, and back then I was not 5'8". I was like 1'2" or something. Anyway, so but trying to go for rebounds, I would jam my middle finger all the time.
Oof.
And there was one time where I got shoved underneath, and the ball hit my mouth, and my
Aye.
teeth came out. Yeah, so I lost a couple of teeth.
How many teeth we talking?
I don't know. There was on the ground. I was on the ground. Teeth were everywhere. I don't
Oh my
remember.
goodness.
Yeah, I don't
Wa-
think it hurt that much.
Was this your baby teeth?
Yeah,
Or
baby teeth.
oh, thank goodness that.
Yeah.
Okay.
No, all of my other teeth came back. That's fine. So yeah, that's one way to lose your baby teeth. Put your kids in sports,
Gosh.
and they'll be gone.
Oh gosh, stop. I'm just picturing it. It's ooh.
So most of my injuries weren't bad. I never had broken bones. Just like small, like little tendon stuff or whatever. I guess. I'm not a doctor. I don't know what it all means, but we have a doctor on in a little bit to talk about it.
Yes.
Is there a sport that you really don't? Because we don't have we have what 3-year-old and a 1-year-old.
Yes.
What sport don't you want your kid to play because you're so concerned about it?
Well, don't come for me, guys. Football. I'm very worried about football. Now if he comes to me
Why?
and he's like, "Mom, please, I really want to play football." Uh, it's gonna be such a difficult conversation because I'm gonna be that mom that's so worried. I'm gonna be so worried about
But
him
you learn so many good lessons from. There's more. There's family.
because it's
And
such a
there's the
contact
building
sport.
thing.
It's such a contact sport. So that's probably the number one. The number one as a mom of a boy,
Mhm.
that's probably the number one sport that if he really wanted to do, I would be worried about him.
What do you want them to play then?
What do I want to play? Well, my husband grew up playing soccer. So we're not going to force him into soccer. I definitely don't want to force him into anything he doesn't want to do, but we're hoping he expressed interest in soccer and likes it. Because that's my husband was a soccer player growing up. So we're gonna try that and see where it goes. But baseball maybe, basketball. There's various sports out there.
Yes. Well, I have a little girl, so
Yeah.
if she wants to play football, I guess she can play football. She can do whatever she
be the
wants.
kicker.
That's right. Lila, I support. No, I want her to be the quarterback, or a lineman or something. No, I think softball would be great. I would love for her to play softball. I also want to be entertained. I want her to be in a sport that I'm gonna be able to
Oh,
get
it's about
into.
you, huh?
It is a little bit about me for
Mm.
sure. This is mainly about me, Lila. And we're gonna train you to be a star. I wanted to name her Shaq actually, because every Shaq has become famous and a great sports player of some sort.
Oh, okay.
You haven't there's no Shaq that I've met that does like that works at a library or something. No, Shaq is a name that plays sports. Uh, but anyways, no, softball would be great. Gymnastics is cool. I've covered gymnastics.
Okay.
The vibe is fun. Everyone's clapping and cheering.
Yes.
There's probably a lot of injuries that come with gymnastics.
Yes, I would imagine so.
Yeah, because there's
It
this
looks
spinning stuff.
very difficult. You have to be very strong.
Yeah, but that's her problem.
Good
So I want to make
coordination,
sure
good
she doesn't hurt.
balance.
Exactly. All the things that my wife did not give in the traits, in the genes, if you will. But I was more balanced. Yes, I'm gonna talk about Jenna. She also knows that
Poor
she is
Jenna, she's not
unbalanced.
here to defend herself.
That's what this show is about. To pick on our spouses as well. Tired husband. No, my wife is amazing. Shout out to her. I
Did
think
she do you know if she experienced any injuries
what
growing
did
up?
she do? I think she did a little bit of softball and some basketball. I imagine she got hurt a lot. Again, this whole lack of balance thing. She's definitely probably got hurt.
Killing me.
No. Well, all right. So softball, gymnastics, that's kind of what I'm looking for. I'm not really concerned about injuries. She already falls a lot, so we're just toughening her up.
Yeah,
Mm,
we definitely got lucky in the injury department in the sports we played growing up. The teeth though, I think you win with that one, Kevin.
Losing teeth, big deal. Whatever. They grow back. They grow back. All right, so we're gonna take a quick break. When we come back, we're gonna have Dr. Tellerico tell us about sports injuries, how to prevent them, why they hurt so bad, I don't know, stuff like that. So we'll be right back.
Hello, everyone. Welcome back to the Tired Parents Club. And today we have with us a very special guest, Dr. Brian Tallarico from Orthopedic Specialist of Piedmont with Piedmont Medical Center. Hopefully, I got all that correct. Thank you so much for joining us today.
Very well. You did. Yeah, good job. That's perfect.
Nice. So today we're talking all about injuries in sports, and with it being, we're full into spring at this point, right? There's so many kiddos out there, elementary, middle school, high school kids, even college kids, right? They're all getting into sports. Out of all the
Right.
sports, what sports do you see? I'm so curious to get your take on this. What sports do you see kind of bringing the most injuries right now?
Most injuries, and I know it's not the right season for it, but football would probably be far and away the highest. But we do have spring practices thing. And, the thing that can lead with is that with children now, they tend to be doing sports longer and almost year round. They go from one sports to another. When I was younger, I won't say what decade that was, you played one or two sports and that was it. And there weren't really any travel teams or the camps and things, very, very minimal. And now it seems like every kid's involved in those. So they're actually training and playing almost 12 months a year sometimes. So the injuries never really go away, but they do peak a lot with the football practices when they begin. And the older kids, obviously, especially high school and college, they do start earlier and earlier. But overall, for the spring, since that's where we are, soccer injuries are very prevalent. The baseball and softball injuries, especially with throwing sports, since those are also spring and summer sports, we see a lot of those. But there you go. Yeah, soccer is very common.
There we go.
Yeah.
Illustration.
R- uh, Excellent point. There really is no break nowadays, huh?
That's correct. Yeah.
Kids just have a full calendar. Um,
Yeah, that leads us to a lot of the other questions you have for me about, how do these injuries present and things.
yeah. Could you get into that? What are like the biggest injuries you're seeing right now?
Sure. So it's a lot of the overuse. Again, back to the kids never really getting a break, and they've been cooped up maybe all winter, and the weather's nice, so they get out playing with their friends and at the team sports, and so they go from maybe a little relaxed to a high level of practice and competition quickly. So we can see a lot of soft tissue overuse, injuries, sprains, and strains. And also the stress fractures, especially with the amount of running that some of the kids are doing in the sports for conditioning, track and things like that. If they weren't running all year round, they go suddenly to intensity of the running or duration of the running, and we worry about foot and other types of stress fractures. So, but a lot of the musculoskeletal stuff is the soft tissue injuries from a sudden increase in the amount of exposure or practice.
So yeah, no, when I was younger, I played a lot of baseball. I played basketball around this time because basketball you could play on both seasons, which was nice. So yeah, I used to like twist my ankle all the time. It's just common
All the
injuries like
time.
that
Wow.
all the time because I used to like to steal, and I would do a slide my. I actually the worst one was I slid my foot under a bag. I got caught into the bag, and I kept rolling over it. And then I was a catcher too, so I still had to catch.
Right.
Um,
Yeah, those base running, base sliding injuries are some of the more common ones with baseball and softball for sure.
Yeah, I started to slide in head first after a while. And I liked getting dirty, so as a catcher, that was just kind of the thing.
Yeah.
Um,
Start using your head. That's smart.
exactly. See, there you go.
Do you guys see when families come in with their children with these injuries, do you find that parents are taking their kids in right away, or sometimes maybe they're waiting a bit to see like, is this serious? And then they're coming in maybe a few days later and realizing, oh gosh, this is worse than we thought.
I think that in the last few years, there's been an uptick in amount of urgent evaluations by orthopedic surgeons in general with athletes. Just because I think of the social media, the exposure. Let's be honest, WebMD. Everybody has a doctor in their pocket with their phone. So if a kid is limping or he has a swollen knee, they automatically get in. So there's a little bit of a panic. I'm a parent too. I have 3 kids, all of them played sports, so I get it. I was more of the just put some ice on, rub some dirt, and it'll be fine.
Yeah.
Or it's just because of how I was raised and being an orthopedic surgeon. But there was a little bit of anxiety sometimes when your kid's hurt, and so yeah, they just want to get it looked at. So we do see a lot of injuries. I saw probably 3 or 4 young kids this morning already, under 12 for injuries, some of which due to sports. So they do get in pretty quick because they're worried about whether they'll be able to practice, whether they want to play, or everybody's the next Nolan Ryan or the next Kobe Bryant. So they're worried about their competition level. So they want to make sure nothing's wrong, which is totally fine. I get it. So we're more than happy to see them.
That's good to hear. That's a relief.
Gotcha. I guess is there so if kids are getting hurt right at this young age or whatever, are they more susceptible to long term effects? I guess because they're still continuing to grow, right? So obviously, like in football, concussions could probably hurt development, or what are some other injuries that could be
Absolutely.
worse?
It's an excellent question. And, I try to convey my advice, my thoughts to parents that come in about the overwhelming amount of sports that some of these kids are playing. And the frequent flyers I see, the ones that come in with injuries almost every year, I really do worry about that because there is a downstream effect of chronic injury, even if it's sprain, strain, soft tissue stuff. And then, of course, you're a baseball player talking about the little leaguers' elbow and the pitcher's shoulder and things like that. Those can be very bad actors. The ligamentous injury, the elbow for these kids that are pitching. I don't know what the pitch counts are up to now for a game, but they're trying to do a better job now than even 10 or 15 years ago, eliminating these kids, especially with the throwing. But you're right, multiple concussions at a young age, those kids, obviously, you need to really look long and hard at keeping them out of contact sports. It's a very unfortunate thing, but it is very scary, especially with CTE development later on in life, things like that.
And that's something that kids aren't thinking about. I didn't think about that. Obviously, my pitch count. I just wanted to throw if I could. Hey, I guess I never really thought about that. When we were younger, they probably didn't care about pitch counts.
Oh, is this such thing? No, it wasn't. That wasn't a thing probably till the 2000s, maybe even later. It's just you threw, and if your elbow is sore, you got a bag of ice on it. So, but the good news is that they are looking at that more closely than ever before. So it does. I would say the amount of those types of throwing injuries that I see are actually going down compared to even 10, 15 years ago.
Crazy, yeah. Because we were talking about also like, what would we have young kids? So where I have a 1-year-old,
3-year-old.
3-year-old, so they're not very involved yet. But I'm like,
Yeah.
what sport do I want them to play in? I don't know. Is that them? They're gonna choose what sport they want to play. I'm hoping
I've
it's
been
not.
asked that before, and I like all sports, and I've played a lot of them. And but boy, baseball's tough to beat as far as it's just a great sport all around. Basketball you can play with one person or 10 people. That's what I've told my son all along. So those sports are great. You do have physicality, but it's not as contact. Now, if the kid loves football, it's really hard to keep him out of it. But there are certain inherent risks you take with hockey and football, especially with the contact and the head injuries and higher energy stuff, the knee ligament injuries and ankle, and there's some bad things that can happen. We all know that. You just hope that there's a little bit of luck involved too. I think to make it through a whole adolescent career without an injury playing the contact sports.
Yeah, and I have a little girl, so I don't know what we're gonna get into. Hopefully, it's softball or some gymnastics or something. I really don't want to do dancing or anything like that.
Hey. I
Gymnastics. I had a gymnast in gymnastics. That's underrated for a contact sport. That's a serious sport, and what those kids go through with the training and the overuse injuries, that is a that is a real sport. Don't kid yourself about that.
No, for sure. But at least as an adult having to watch it, I'd be entertained a little bit more. And plus, the vibe is actually really cool. I've covered gymnastics before.
Yeah.
Everyone's so supportive and lots of cheering and stuff, and
Yeah.
it's great.
No, it is. It's in a great environment. It really is. I didn't know much about it until my one daughter started doing it.
Surprising.
We always joke around in my family because we have a little boy, and I've always said if he comes home and wants to play football, he's gonna hate me because I'm going to be like, no, please don't play football for just like the concerns that come with it. But yeah, we'll tackle that when the
When we get
time
there.
comes. Yeah, when we get there, right?
Uh-huh.
Unintended.
Yeah. Yeah, exactly, right? I
You
totally
didn't even
meant
need
to
to
do
pick up on
that.
your
I
own.
totally meant to do that.
Uh-huh.
When it comes to recovery from injuries, I'm sure depending on the extent of the injury and where the injury is located, it may take longer to recover than others. In your profession, what do you see? What are some of the most difficult injuries that, take a really long time to recover from?
A lot of the fractures, we do fractures from the actual sports, but we also see them outside of sports, and then they'll come in and ask how long we have to wait to send my kid back to practice. And it's a really tough sell. You can see it in their eyes. You tell them this is probably 6 to 8 weeks, and they blink. Well, he's a really fast healer. What if 3, 4 weeks he doesn't have any pain? So it's a bit of a struggle sometimes with the family, trying to convince them that these bodies need to heal, and they do heal faster than us old people, but they still need appropriate amount of time to. Mother Nature's Mother Nature, physiology is physiology. So to heal fractures or with torn ligaments or pulled muscles, it does take some time, and it's common sense. If you go back before you're healed, you're probably gonna have a recurrence of the same injury. You're gonna start from square one, because that's how I try to sell it. You can go back. I can't force you to do anything. You're asking my opinion as an orthopedic surgeon. If you go back too soon, you're probably gonna be back again, and now you're starting from day one, basically.
Yeah, because I was the kind of person that I would still play. I wanted to play, and so if I was injured, I don't know. I wouldn't. I didn't want to show it because I wanted to play catcher. I really wanted to play. I didn't want to prove that I was hurt.
You
I
would
imagine
re-injure yourself, Kevin, huh?
I would, yeah, and I didn't mind it. But I just,
Terrible.
and I think that's how a lot of kids are. And a lot of parents kind of are like that, right? They just kind of want to push their kid until, yeah, it becomes a worse injury, I guess.
Importance of listening to your doctor and being patient.
I guess. All right, thanks for joining us. We're gonna take a quick break. We'll be right back. Welcome back to Tired Parents Club. We were talking about sports injuries. So one thing we haven't talked about is how can you prevent these injuries?
Well, there's two types of injuries in sports, orthopedically speaking. You have the traumatic ones that are just really hard to prevent. They're usually bad luck, a misstep or a tackle or a deceleration. With the soccer clip there, the deceleration injury, changing directions, rupturing ACL, things like that. It's just, like I said, sometimes some bad luck. So, but overall, to prevent injuries, it's preparation, and that's why the training is so important, and the warm up is so important, and the conditioning is. The healthier the soft tissues are, the better the bones are. Obviously, the more resistant they are to injury. So you just sometimes can't predict a freak injury or a bad accident. The accidents happen. That's what keeps orthopedic surgeons in business. So, but a lot of kids now are way more in tune with the nutrition, and that's not just them; it's their parents too, and coaches and staff. So there was no such thing when I was a kid, when I was a young athlete. It's just basically maybe Gatorade was out back then, so we would drink Gatorade. But I think the dietary, just the whole thing about sports nutrition is a relatively new thing over the last 10, 20 years has really helped. I believe that I'm a real proponent of proper nutrition for these athletes. You figure how many calories these kids are burning when they're practicing 2-3 hours a day, especially like the wrestlers and the runners and the football players, the ones that are out in the heat during practice for 3 hours. It's ridiculous how much they burn, and also the fluids. I think that the coaching staff and the athletic staff, they're much better now than back when we were younger. So I think that that's a good thing, and it does help prevent a lot of injuries. But the other thing is just the signs we'll see in these kids if they're starting to limp or if they're favoring a shoulder. I think the parents really have to keep an eye on them, because, as you said, the kids will just keep their mouth shut because they want to keep playing. They don't want to let their team down. They want their coaches down. But if there's something wrong with your kid, you gotta pick up on it. You gotta pay attention. If he's limping, if he's asking for motion, or Kids don't take Motrin or Advil or Aleve or Tylenol like adults do. They just don't. They never ask for it. They're asking for it because their knee hurts or the foot hurts or the shoulder hurts or the back hurts. You really gotta have an open eye for that. You have to get them evaluated because that's not normal. Sprains and strains are one thing. Just being sore from lifting weights or working out with the team is different. But when they're actually hurting, you can see it in their eyes and the way they carry their body. You really need to intervene and see what's going on.
We were told to do lots of stretching beforehand. Is that something we should really do? But as a kid, I was like, I'm not gonna stretch. I don't need to do that. I don't know.
What's interesting about that, I don't think there's ever been any scientific data to show that stretching for 5 minutes or 10 or 20 minutes actually does anything. Again, hard science and data, but I think it does help to warm up for sure. I think if
Something doesn't hurt.
it's part of the stretching is part of warming up, but warming up I think is vital to avoid the pulled muscles and tendons and things like that. And it's just to get your joints moving and get ready for the arduous practice.
Yeah, that makes me think of like the swimmers or whatever, like Phelps, when he did the arm thing. It's like slap his back, and the lactic acid going or whatever it was. Yeah, I mean, I did that only seeing him do that, and I would play baseball, and I'm like, does that really do anything for me as a baseball player? Whatever, I'll still do it. It made me feel loose. That's all that mattered.
I think as a pitcher for sure, obviously throwing that hard, I think warming up slowly and warming up the joints and ligaments and muscles for sure.
Okay. I have a random question. Um, when a hyperextension happens, can you explain what exactly that is and how that can occur when kids are playing sports? Because growing up, I had several classmates and friends that
Extension.
hyperextended their foot or their leg, and can you just explain to our viewers what exactly that is and
Sure.
how it could?
Typically, the two joints that would be prone to hyperextension injury the most would be the knee and the elbow. Because the elbow is more of a true hinge joint than the knee. The knee is not a true hinge joint, but as we know, it goes straight and it flexes. Flexion is when you bend your knee. So straightening your knee out to 0 degrees, a hyperextension would be going plus, 5, 10, 20 degrees. That's hyperextension. Where the knee actually goes further than 0 degrees. We usually flex between, let's say, 125 and 145, 125 to 145 degrees, depending on your age and flexibility. So, but you can injure the knee and the elbow in both directions, hyperflexion and hyperextension. The knee hyperflexion injury, you can tear ligaments and tendons. But the hyperextension injuries are pretty common. Those will also in the knee tear your important ligaments and maybe meniscus cartilage and things like that. And actually fractures can occur and cartilage injuries. And in the elbow, that would be more of a fracture, especially in the pediatric population. Hyperextension injury to the elbow, fall from height, things like that. You can get injuries about the elbow. Supracondylar is one that's the most common, right above the elbow joint. So those are pretty nasty sometimes and need surgery. But in sports, the knee being hyperextended, most of the time, especially in the younger, if it's a lower energy, the younger population will just have swelling and sprain strain, as we call it. But obviously, the more it extends or hyperextends and the higher the energy, you can certainly tear your ligaments.
Oh, so we have maybe a minute left or so. What's a 30-second takeaway for parents for this episode?
I would say that with the kids participating in sports this spring, it's important to have them go back into it slowly, properly, warm-ups, conditioning before going full bore into competition and high-level play. That'd be number one. Number two would be proper nutrition, hydration, as always, very paramount. And number three would be watching for signs and symptoms in your kid about injuries that are starting, whether like hyper or overuse injuries and things like that. So we want to just keep an eye on those. And if something looks out of place with your kid after a couple of weeks, then you really should get them evaluated.
Wait, thank you so much for your time. That was super educational.
Yes.
I'm going to replay this episode back for me in about 4 or 5 years. So I appreciate it. Thank you again for your time. And thank you, everybody, for watching Tired Parents Club. We'll be back next time with another episode.
Queen City News Plus. Just search Queen City News on your smart TV's app store.